Bismillahirrahmanirrahim. Today's lecture is about how to pass IMM course in first attempt. I will discuss about the outline, how to prepare your exam, the stations that will come in your exam, and then how to perform in any station and what to speak. So the stations involved in your IMM exam includes drills, which are both gynae and ops. The counseling, one station is about counseling, another one is about anemia or any PPH case-based scenario. The scenario will be given and you will have to solve that case. Another station includes the critical appraisal of leaflet and research article, discharge slip mistakes on appraisal, or any operation notes appraisal. Or there will be the research scenario, audit cycle and its example, and how to write a protocol on any particular topic of gynae or ops. Another one station that is coming nowadays in IMM exam includes pap smear performer, and contraception is the topic and includes in the syllabus and the curriculum in the IMM level. And regarding contraception, any of the station can come, whether it's in the form of drill, in the form of any counseling, any case-based scenario, and any radiographs like lost IUCD X-rays. So the radiographs that comes in your syllabus includes some star salpingiography, HST. It can be any how to perform that station and how and to interpret the HST report, any ultrasound report and X-rays of mainly lost IUCD. Another important station of your exam is labor board and how to prioritize the labor board. There will be the two stations or it can be the one station in which you will be given the labor board to read and prioritize, and then in the next step you will have to discuss that labor board prioritization with your examiner. Another one includes labor care guide by WHO, which is the recent advancement in the labor care guide and has class the partogram. So another important thing about that is the partogram versus labor care guide. You can have the station regarding its comparison, the latest points which is the labor care guide has been added. One of the station is about the hysteroscopy and its details. Another one will be about breastfeeding. One station is about Apgar score, Bishop score, and the modified Bishop score, which is the latest one. And the scenario will be given, and you will have to ask, and you will be given a task to identify or calculate the Bishop score and manage the patient according to that particular score. Same is the way with the Apgar score. Any neonatal resuscitation or Apgar score will be given and you will be asked to perform the procedures, what to do next. One of the station includes sexual assault or domestic violence. Another one will be the gowning, gloving, and scrubbing. So let's talk about the details of each and every station. In the drills, it is divided into obstetric drills and the gynae drills. Obstetric drills are further divided into the labor drills. So the labor drills include clinical pelvimetry, obstetric examination, mechanism of normal labor, delivery of head in obstetric position, assisted vaginal delivery, breech delivery, external cephalic version, internal podalic version, twin delivery, manual removal of placenta, and episiotomy. Any of the labor drill can come in between these topics. The obstetric drills regarding emergencies which are peculiar to the IMM syllabus includes shoulder dystocia, postpartum hemorrhage. It can be the flow chart of the postpartum hemorrhage, the protocol writing of the postpartum hemorrhage, or if we talk about the drills particularly, so it can be how to repair the cervical tear or any vaginal laceration and a tear repair. uterine compression sutures, which includes the brace suture, Beeling suture, and many other types. You should know the names of all the compression sutures and the latest modalities available. Uterine, another one is the uterine artery ligation and the balloon tamponade. Balloon tamponade and its different types like the tampon balloon tamponades, the condom balloon tamponades, sand-taken tubes, and many latest modalities. You should know about each and every detail of the balloon tamponade and its types. And the one drilling can be the cord prolapse. The flowchart is given in your reference books, the uterine inversion, BLS in the collapsed patient, and neonatal resuscitation. So now there will be the station regarding the gynae drills, which may include the intrauterine contraceptive devices. You should have a firm grip on both of the devices, copper T and Mirena, and its subtypes and types as well. Like in the Mirena hormonal contraceptive methods, they are Mirena, Skylina, and JD. So you should know the type of the progesterone, the dose of the progesterone in all of them. And so with the property and the multi-load, the difference between the simple property and multi-load. Afterwards, there is a very important station regarding the IMM syllabus is MVA, manual vacuum aspiration. You should know the details about MVA, how to assemble, how to disassemble, and how to sterilize that MVA. Afterwards, the Incranol and other types like Nexplanon, Jadale, they are the types and how to perform that drill in the patient. You should have a firm grip on it. Another station regarding gynae drill can be the pap smear, pipal sampling, diagnostic, DNC or therapeutic DNC, dilatation and curettage, hysteroscopy, hysterosalpingiography, IUI cannula, ring pastry, and med. If we talk about how to perform the drills, it is very easy. If you just learn these lines, start and end of these lines, you will gain the maximum marks and just you have to perform the drill while demonstrating. So let's start how to perform the drill. I will introduce myself to the patient, take informed consent, explain whole procedure. After fulfilling all the prerequisites and ruling out contraindications, I will proceed to perform that particular drill in front of the chaperone. This is the main line in which there are many numbers and according to the rubric assessment of your exam, the 0.25 or zero point 0.5 marks of each and every point which I have explained so far. Afterwards, say, I will ask the patient to empty her bladder and lie supine comfortably. Do the examination if necessary, especially bimanual examination in the cases of every gynae drill. Help in proper exposing with the privacy and then perform the procedure. So these beginning lines or the start lines, if you have done that good and well, it will secure you the maximum marks. And then the rest of the procedure, perform it carefully while demonstrating each and every step. And then in the end, you must say that in the end, I will help in dressing and say thanks to the patient. Document my finding or my procedure with date, time, name and signature and ask for the follow-up if necessary. So these are the things and the lines if you speak in your practice and exam, you will gain the maximum marks of introduction and each marks. And the rest of the marks will be covered when you perform the procedure. Another station in your exam is about the counseling. There will be another lecture on the detailed counseling and with examples, and it will be the interactive session. So the major ops and gynae counseling stations include and stay counseling of the anomalous baby. It can be Down syndrome, neural tube defects while showing the ultrasound picture and ambiguous genitalia. It can be regarding the sudden intrauterine death, maternal infections. The mother has been suffering from rubella or chickenpox and she is worried regarding her baby outcome. So there will be the counseling session regarding that. Pre-pregnancy counseling of obesity in pregnancy, pre-pregnancy counseling of thalassemia, in pregnancy, it is very, very important. Epilepsy in pregnancy, postnatal depression, HIV, hepatitis B and C, and its outcome and neonatal outcome in pregnancy, genetic counseling and the pre-genetic diagnosis, PGD is important. So these are the OPS counseling stations so far, and many more can become. The gynae most important counseling stations according to the IMM level includes malignancy, cervical intraepithelial neoplasia, heavy menstrual bleeding or menorrhagia, hysterectomy, the counseling regarding how to ask or counsel the patient regarding the hysterectomy, contraception, molar pregnancy, ectopic pregnancy. Okay, another station that comes in your exam is anemia-based scenario, any case-based scenario. They can be anemia, it can be postpartum hemorrhage, it can be obstetric cholestasis. Most importantly, usually anemia comes. So the scenario can be anything, and you will have to ask about all the prerequisites and further detailed points. The scenario, for example, there will be the scenario that a 29-year-old gravid of 5 para 4 previous STDs at 30 weeks with came with complaint of pallor and shortness of breath. So you can be asked about take the relevant history points regarding the cause and the risk factor of the anemia and the severity and complication. You should follow each and every step of the history. Then examination relevant to the general physical examination, systemic examination relevant to anemia, including the CVS examination, and then since the patient is pregnant, so obstetric examination. Afterwards, ask about the investigations. In the investigation, you should know what and why to ask. There will be the justification of each and every step of investigation. Usually, we follow with the initially complete blood picture for the anemia. And since the patient is pregnant, so you will ask about the general investigations and the specific ones. And then follow with the management. You should know when to give oral iron, when to give parenteral iron, when to give blood transfusion versus PCV transfusion, and the postpartum supplements. So these all will be covered in your one station, which is the case-based scenario station.